ऐसे उल्टा करके ये कर अच्छा ये
तो सुपरली फ्रेंड से पता लगना चाहिए किधर जा रहा है किधर जा रहा है।
जैसे आएगा देख लेते हैं एक्सपेरिमेंट किया। So today's topic
पोल के पर उधर से दिखने का नहीं फिर इसमें क्या है।
अच्छा
Now today's topic is hyperpyrexia. Now what is pyrexia? Pyrexia means क्या मतलब होता है pyrexia का? Fever. Now normal यहाँ पे किसका बैग पड़ा है वो बैठ जाओ। Pyrexia means fever. Normal temperature of body कितना होता है? 98.6 degree Fahrenheit and 37 degree Celsius. So this is the normal temperature of the body. In the morning hours, the temperature is a bit low, maybe up to 97 degree. Then afternoon, it may be around about 99 degree Fahrenheit. This is normal variation of the temperature. Now, what is hyperpyrexia? Definition. It is defined as temperature of the body more than 106 degree Fahrenheit. So when this temperature in a patient occurs, the condition is labeled as hyperpyrexia. There is another term, high fever, that is temperature up to 103 degree Fahrenheit. So 103 डिग्री फ़ारेनहाइट तक जब टेम्परेचर हो किसी पेशेंट का, उसको हम कहते हैं कि पेशेंट को हाई फीवर। उससे ऊपर अगर पेशेंट को फीवर होता है तो उसको हम हाइपरपायरेक्सिया लेबल करते हैं। नाउ व्हाट आर द वेरियस causes of hyperpyrexia? Causes of hyperpyrexia. Number one, infections in the body in any organ, commonly respiratory tract, GI tract, urinary tract, and bones and joints. So these four common organ systems of the body, when get infected, lead to the presentation of fever. Next time we go. Fever itself is not an illness. Fever itself is not an illness, but it is the symptom of disease present elsewhere in the body. Next time we go. The infections can be the infections can be infections can be number one, bacterial, number two, viral, and number three, parasitic. Parasitic. The infections can be bacterial, viral, or parasitic. Now coming to bacterial, the organisms which are highly responsible for hyperpyrexia are number one, Streptococcus pneumoniae, इसको Streptococcus pneumoniae क्या इन्फेक्शन कॉज करता है? निमोनिया ऑफ द कहाँ पे होता है निमोनिया? लंग्स. So it causes pneumonia in the lungs. Streptococcus pneumoniae causes pneumonia in the lungs. Why it is called Streptococcus? Why the name of the organism is Streptococcus? Cocci हो गए and जब उसकी स्लाइड देखेंगे माइक्रोबायोलॉजी में they will be in straight line ऐसे करके हमें मिलेंगे. That is why it is labeled as Streptococcus. Straight line में कोकाई पड़ी. Number second bacteria is Staphylococcus. Staphylococcus aureus. In Staphylococcus, what is the presentation to the slide? It will be in bunches, like grape bunches. अंगूर देखें, ऐसे आपको स्लाइड में जब हम उसका कल्चर मीडिया से लेकर स्लाइड ला के देखेंगे ट्रांसलेट करके, तो हमें ऐसे बंचेस में दिखेंगे. Why it is called aureus? Because aureus को कहते हैं, it glows like gold. Aureus gold का नाम है ना. Chemical name of gold is aureum. और mercury का क्या नाम है? What is the name of mercury? Chemical name? Hydrogen. बीपी का हम कैसे मेजर करते हैं? मिलीमीटर ऑफ मर्क्यूरी. और लिखते कैसे हैं? mmHg. जी बड़ा होगा छोटा? छोटा. So hydrogen, that is chemical name of mercury. Aureum is chemical name of gold, and argentum is chemical name of silver. Ag. So second is Staphylococcus aureus. Third organism is Haemophilus influenzae. Haemophilus influenzae. So these three bacteria, that is Staphylococcus, and Haemophilus influenzae, cause high grade fever, that is hyperpyrexia. Then coming to the second infection, that is viral. Viral group, they are influenza group of virus and para-influenza. Influenza and para-influenza is the organism in viral group of organism causing infection leading to hyperpyrexia. Then third group, that is parasitic, that will be malaria. Malaria में बहुत जुकाम, 104, 5, 6. How many types of malarial species are present? Anyone can tell me? Oh, कौन कौन सी है? एक जना बताइए. एक जना बताओ कौन सी 4 स्पीसीज हैं? प्लाज्मोडियम. प्लाज्मोडियम तो आपको स्पीसीज, जीनस आपको पता है. प्लाज्मोडियम स्पीसीज आप बताइए. पहले हमें सबसे फ्रीक्वेंट जो है प्लाज्मोडियम वाइवेक्स, ऐसे नहीं बोलना, जो याद आ गया वो नहीं, सबसे पहले क्लियरली बोल दो, ऐसे नहीं। सबसे पहले प्लाज्मोडियम वाइवेक्स, सेकंड इज falciparum, third is ovate, fourth is malaria. So four species of parasite plasmodium are there, and out of these four, vivax and falciparum are more common, and they cause hyperpyrexia. Then second, after infections, second group of causes is intracranial hemorrhage. Intracranial hemorrhage. Intracranial hemorrhage can be due to number one, stroke. Stroke means cerebrovascular accident. How many types of cerebrovascular accidents are there? मैंने बताया वो आपको. How many types of cerebrovascular accidents are there? चार तरह के होते हैं. Intracranial hemorrhage. Number two, subarachnoid hemorrhage. Number three, thrombosis in the cerebral vessels. And number four, ischemic cerebrovascular accidents. CVAs, they are four in number: hemorrhage, intracranial, subarachnoid. Intracranial means inside the brain substance. Intracerebral. Number two, subarachnoid. Subarachnoid space कहाँ पे है? कहाँ पे होती है? Arachnoid और where is subarachnoid space present? जी वॉइस में से कोई बताएगा? What is the subarachnoid space? मुंह नीचे करके क्यों बैठे हो? खड़े होके बताओ. Get up. What are the three membranes of brain? Pia matter, arachnoid matter, dura matter. So subarachnoid कहाँ हुई? Arachnoid dura के बीच में. Dura कहाँ पे है? Dura is outermost, just lining the skull. उसके बाद आएगी arachnoid, फिर आएगी पाया. Arachnoid और पाया के बीच में subarachnoid space, वहाँ पे cerebrospinal fluid होता है. तो वहाँ पे अगर हेमरेज होगा उसको हम कहते हैं subarachnoid hemorrhage. Second cause of intracranial hemorrhage is head trauma. Head trauma. Number three, accidental injuries in the brain substance. And number four, vascular lesions in the hypothalamus. So ये second group of causes. Third group of causes, septicemias. Septicemias, when the infection from any organ of the body travels to whole of the body through the systemic circulation, affecting all the organs of the body, the condition is termed as septicemia. It is usually seen. It is usually seen in patients of severe gram-negative or gram-positive organism infections, affecting organs like urinary tract, including kidneys, GI tract, lungs, and bones and joints. The patient is highly serious. The patient is highly serious, and if not adequately managed, if not adequately managed, it may lead to multiple organ failure, especially kidneys, leading to acute renal shutdown and consequently other organs are also affected. Then after sepsis or septicemia, third cause, direct side effect of direct side effect of certain drugs. इसको लिखो number 1, general anesthetics. Number 2, antipsychotic drugs. Antipsychotic drugs. Number 3, drugs used by drug addicts for pleasure, like cocaine, LSD, etc. So these drugs also cause hyperpyrexia. Then fourth is Kawasaki syndrome. Saki syndrome. In this condition, there is generalized inflammation of the medium sized arteries of the body. Now this is regarding causes. Now coming to the pathophysiology. In the human body, in the human body, hypothalamus in the brain, hypothalamus in the brain is the thermostat which normally controls the body temperature. In patients, in patients of hyperpyrexia, the brain sends the message to hypothalamus. The brain sends the message to hypothalamus, that is thermostat, to raise its baseline temperature above normal values. So, accordingly, the baseline temperature of the body is set at a higher new level of 106 degree Fahrenheit. ब्रेन में काम कौन सा एरिया सेट करता है? सेरिब्रम. जो हमारा सेरिब्रल कॉर्टेक्स है वो कंट्रोलिंग है सारा. सेरिब्रल कॉर्टेक्स के जो न्यूरॉन्स हैं, जब उनको इनपुट मिलती है, जो कॉजेज भी हैं, मैंने बताया इन्फेक्शंस, हेमरेज और ड्रग्स, तो इनपुट जब जाती है तो ब्रेन क्या करता है? सेरिब्रम सेंड द message to the hypothalamus to raise its temperature to higher level of 106 degree Fahrenheit. And that is why the body raises its temperature. So this is pathophysiology of hyperpyrexia. एक अगर अगली टर्म पढ़ेंगे हाइपरथर्मिया, उसमें हाइपोथैलेमस जो है वो काम नहीं करता क्योंकि ब्रेन को पता ही नहीं है. वो बॉडी इज एक्सपोज टू excessive heat as occurs in heat stroke situation, so body अपने आप ही गर्म हो जाता है. That is called hyperthermia. Hyperpyrexia में it is caused by the cerebrum and hypothalamus to raise the baseline temperature to 106 degree Fahrenheit. Now coming to the clinical features. Along with fever, along with fever of high grade value, that is 106 degree Fahrenheit, patient has following symptoms. एक एक लाइन में लिखना है सबको. Increased thirst, leg pains, next time लिखना है leg pains, muscle cramps, extreme sweating, generalized fatigue and weakness, nausea, vomiting, and lightheadedness. Lightheadedness. These symptoms are at an early stage. Later on, next line में लिखते जाना. Later on, this high temperature leads to severe headache, visual disturbances, confusion of the thoughts, drowsiness, and later on coma. Next line में लिखते रहना है. There may be features of shock. So, can anybody tell me the features of shock? Cold, clammy skin, pallor, tachycardia, aneuplia or oliguria, fever pulse, BP will be all less than 90 millimeter of mercury systolic. Normally कितना होता है 120 by 80, 120 millimeter systolic, 80 millimeter diastolic. Range is 90 to 120. Systolic की range भी पता होनी चाहिए आपको. 90 millimeter to 120. Diastolic 60 to 90. So जब systolic blood pressure comes less than 90, there is feeble pulse, tachycardia, pallor of the skin, cold clammy skin, and patient is drowsy, oliguria and urea. Such features are seen in cases of shock, also known as peripheral circulatory failure. Next time लिखो. Some patients may get convulsions and ultimately there may be organ failure. So these are features of hyperpyrexia. Now coming to the treatment. Number one, the treatment includes first treatment of the cause, which can be infection, intracranial conditions, drugs, etc. treatment of the cause, and number 2, rapid lowering of the body temperature. Rapid lowering of the body temperature. This rapid lowering is done by, अब इसके आगे नीचे लिखो कैसे rapid lowering करेंगे. Give patient cold bath or cold wet sponges on the body. Number 2, intravenous cooled fluids. पानी को जो cold हमारे जो fluids हैं, DNS, dextrose 5%, RL, etc. They should be cooled down in a ice bath and they should be transfused. So cooled IV fluids should be given. Number 3, some patients may need cooled water or saline enemas. Then number second point after the treatment मैंने लिखा है second point, antipyretics like paracetamol injection is given. Next name लिखो other drug tablet ibuprofen. ibuprofen पता क्या है? Brufen. Brufen tablet आती है 400 मिलीग्राम 200 600. Tablet ibuprofen can also be used or a combination of ibuprofen and paracetamol can be used. Number 3, the investigations should also be got done side by side, like blood culture, urine culture, culture of sputum, X-ray, X-ray test, CT scan brain, ultrasound of the abdomen to find out the cause of hyperpyrexia. So that's all for hyperpyrexia. That's all for hyperpyrexia.